Hi, I wanted to go over the video, our presentation using a video, and I want us to understand what we're going to do and how we're going to say it. We can't meet, but this is the next best thing. So here we go. One of the biggest health issues that has occurred is the pandemic of the HIV virus. What do I mean by pandemic? Well, according to the CDC, an epidemic refers to an increase, often sudden in the number of cases of a disease, above what is normally expected in that population in that area. Whereas a pandemic refers to an epidemic that has spread over several countries, affecting a large number of people. We've each strategically researched this global health issue, and so have many other members of the healthcare system. We're going to talk about not only the history of HIV, which gives you an exponential grasp on strides of progress that have been made to date, but also including a preventative solution. Then we'll speak about the social, economic, political, and ethical aspects of HIV and how they're all related to nursing. HIV was first reported as a new and distinct clinical disease by the Center for Disease Control and Prevention in June of 1981. At the time, the condition did not have a name. Doctors in San Francisco, Los Angeles, and New York had documented an unusual cluster of diseases in young homosexual men. These diseases, Kaposi's sarcoma and pneumocystis carinii pneumonia, were previously unknown to this group. Since all the first cases of the newly identified disease involved homosexual men, researchers initially considered sex among gay men the route of transmission. The condition was named GRIDS, Gay-Related Immune Deficiency Syndrome. However, HIV cases were soon reported in other populations as well. HIV/AIDS has spread to virtually every continent on the planet. Approximately 33 million people worldwide have the disease. Presently, the country with the largest population of people living with HIV/AIDS is South Africa, with 5.5 million people. And there are about 1.1 million Americans living with HIV/AIDS, with 55,000 new infections that occur every year. Now, this is the social aspect. This will be me. When researching the social component of HIV and how it relates to nursing, it was found that there's always been a stigma related to the contraction of the disease. Well, what do I mean by stigma? Stigma is a mark of disgrace associated with a particular circumstance, a mark of shame, a set of negative and often unfair beliefs that a society or group of people have about something, forcing those who have the disease to become potential targets, subjected to subsequent discrimination and or alienation. But in the nursing field, we have to be non-judgmental. No matter how society views the disease, we provide care using standard precautions, whether we are aware or not. When a survey was conducted on HIV and the effects of nursing, one nurse reported that when disposing diuresis, she was more careful than she would have been normally with any other patient. Standard precautions is considered to be hand washing and putting on gloves. That's the basics. Some people call it universal precautions, but those are the basics for protecting yourself and your patient. You can get HIV through unprotected sex, pregnancy, childbirth, and breastfeeding, injecting drugs, or as nurses working in the healthcare field. U.S. federal funding for HIV/AIDS by category. Fiscal year 2018 request. So globally, the United States is spending $5.4 billion on the prevention of HIV For domestic cash and housing assistance, we're spending 3.1 million. 2.2 billion on domestic research and domestic prevention here on our land, $0.7 billion. For domestic care and treatment, we're spending $20.7 billion. That's 65% of our funding across multiple agencies and programs go towards assisting in HIV. So Olivia, you'll just ad-lib that. Just reading the PowerPoint straight off. There are federally funded programs such as Medicaid, Medicare, the Ryan White HIV/AIDS program, and CDC's HIV prevention program that helps provide health insurance coverage. These programs can also provide routine care, access to medications, and social supports for people with HIV. And there is something that I'm going to text you, Olivia, to read here, but this stays up for a while, and you're going to read the connection between nursing and economics. Today, and because of the spending on nursing and economics and educating and treatment and prevention, every nurse is an HIV nurse, and you'll read this, implying that all nurses are responsible for teaching methods to reduce risk of transmission. The nurse must be able to discuss the details of behaviors relating to sexual activity and drug use in a forthright, relaxed, and non-judgmental manner. Nurse must be able to establish rapport before asking sensitive, explicit questions, and one must be comfortable with the discussion of risk reduction techniques. Harm reduction education is a fundamental element of HIV prevention methods. And this would be more on the economics. We could start off by just reading this. Where are we lacking? In the political aspect of HIV, 63% of millennials believe that the government should spend more on HIV prevention and care. And you can go on and reading this. Read all of that. I'm not going to go through it. You have a basic idea. I'm going to email everyone this PowerPoint. Ethics. There's something that I just want you to define. When you start off, we're going to immediately define what ethics is right here, Autumn. Beneficence. An ethical principle that addresses the idea that a nurse's action should promote good. And just as we spoke, non-judgmental, harm prevention, that's all being beneficence. And when dealing with an HIV positive patient or someone awaiting their HIV results, it's important to adhere to this ethical principle, beneficence. End HIV transmission, end isolation, end stigma. Hashtag let's end it. Did you know there's a pill to prevent HIV? It's 99% effective. PrEP is a new prevention method in which people who do not have HIV infection take a pill daily to reduce their risk of becoming infected. And if you want to ad-lib here, you can ad-lib. So from there, what I'll do, because we have to stop the music, I'll probably just use the volume to turn it down. And we will watch the video.
People are talking about PrEP, but what is it and what does it do? PrEP means pre-exposure prophylaxis, and it's the use of medication to help keep someone who does not have HIV from getting infected with it. This is important because HIV continues to be a worldwide health crisis. In the US alone, there's an estimated 1.2 million people living with HIV, and many of them do not know they're infected. About 50,000 people become infected with HIV in the US every year. There are lots of ways to stay safe from HIV, and using condoms has been the main strategy for years. PrEP, though, is a new HIV prevention strategy that's recently been approved by the US Food and Drug Administration, also known as the FDA. In order to approve PrEP for use in the US, the FDA looked at results from several research studies that found PrEP was safe to use and effective at preventing HIV infection. People in the studies who took PrEP every day reduced their risk of getting HIV by as much as 99%. However, people who did not take PrEP every day were not as highly protected, and people who didn't take PrEP at all got no protection. So, how does it work? Let's take a look at how PrEP helps prevent HIV infection in your body. Your body is protected by special cells in your immune system called CD4 T cells. These cells normally help keep you healthy when you're exposed to a germ or virus. But when HIV enters your body, it hunts down these T cells, attacks them, and uses them to make copies of itself at a very high rate, as many as several billion copies per day. These new copies of the virus go out into the body and hunt for even more T cells to take over, using them to make even more copies. The immune system just can't keep up with the virus to stop it from making all those copies.
Okay.
And that results in HIV infection.
So what we're going to do after that, we'll have the conclusion. Basically, the small paragraph that we have, Shayla, at the very end of the document online, the doc that we have, at the very end, that paragraph, if you could just memorize as much as that as possible, you have it, you can go over it, write it down, do whatever you have to do for it, but it's going to be, all those things are going to be very important to say, all those topics. And what I want to do is I'm just going to add, while you're doing the conclusion, we are just going to have this up right here. Yeah, this is good. I think this is perfect. Yeah. All right. And that'll stay up until the end. I'm going to find a way to reduce the music. Maybe we don't have to leave PowerPoint. We could just let it play through. But other than that, guys, that's the wrap. Thank you for everybody putting in their paragraphs and doing their research and posting their references. If anything, all you need to do is add extra references. This is due on the 29th, and that's a wrap. I have to get on to practicing for or studying for this test on Monday. But I'm not going back into this again. It is absolutely done. It's up to you to memorize what you got to memorize. Good luck and thanks.